Health officials reporting more COVID-19 cases. Good evening, I'm Desmond Saunders. Welcome to the Bahamas Tonight, the National Report. Thank you so much for looking in. We begin tonight with news on the COVID-19 pandemic as Ministry of Health officials have confirmed 2 new COVID-19 cases. This increase comes as no new cases have been reported in the Bahamas since the middle of June. Prime Minister, the Most Honorable Dr. Hubert Minnis, providing an update on the government's response plan to the COVID-19 pandemic in this report from Altavis Munnings.
The total number of positive COVID-19 cases in the Bahamas changed Wednesday when Acting Minister of Health, Prime Minister the Most Honorable Dr. Hubert Minnis, revealed in the House of Assembly that health officials discovered new cases in Grand Bahama, pushing the total count now to 106.
2 additional cases was confirmed in Grand Bahama this morning, and 1 case is equivocal and waiting for confirmation at this particular time. Health officials at this time are in Grand Bahama doing their surveillance and at the same time are investigating any forms of contact or possible spread, Mr. Speaker.
But with COVID-19 cases and deaths on the rise globally, the Prime Minister emphasized that the pandemic is far from over. Although many countries, including the Bahamas, instituted lockdowns and curfews to mitigate spreading the virus, Prime Minister Minnis listed the consequences the healthcare system would have faced if government didn't respond quickly and effectively to the pandemic.
It means that you will have no beds for sick patients because your hospital is being utilized by all COVID patients. It means that all elective cases are cancelled and you have great difficulty even performing emergency cases. It means, Mr. Speaker, that our routine maternity cases cannot be cared for properly and babies can be born at home or wherever because our hospital is in a meltdown. It also means, Mr. Speaker, that our children, our kids, who need hospitalization for care, there'd be no facility for them. Because we were so overwhelmed and dealing with the COVID cases, our immunization numbers had subsequently decreased. What it means is that the percentage rate that we were immunizing our population has now decreased because we were so focused with dealing with COVID-19. We've not had a meltdown, but our rates have deteriorated. Now we are predisposed to a high incidence of mumps, just from the little that we've had today. So imagine what happens if we have a meltdown. We're at greater risk for measles. We're at greater risk for rubella. And Mr. Speaker, what it also means is because we're at greater risk at rubella, our young people who become pregnant would be at greater risk of having abnormal infants. That's what we have today. And we don't have a meltdown.
The Prime Minister also reiterated that beaches in New Providence, Paradise Island and other keys around New Providence, as well as in Grand Bahama, will be closed during the upcoming Independence holiday weekend. He added, though, that mass gatherings create a super spreading of the COVID-19 virus.
Those individuals who had returned from Florida within 72 hours, I understand about 172 of them, they walked into the hotspot and came home. I'm not saying they're infected because we follow protocols and try to adhere as much as possible. But should one of them become infected, they can share the virus outside of the incubation period, outside of the 14 days. We say they show symptoms at the 14th day. But during that time, they can share the virus. 3rd day, 5th day, and infect all of us, yet they're normal.
Altavis Munnings, ZNS Network News.